All right, let's dive into something huge. We're talking about one of the most exciting frontiers imaginable, artificial intelligence in medicine. And look, this isn't some far-off sci-fi promise. AI is changing healthcare right now. So, let's get into it.
Okay, let's start with just a number, 5. What does that make you think of, in a medical sense? 5 minutes with your doctor, 5 days to recover from the flu? It's actually something way, way bigger than that.
Yeah, this is the power we're talking about. Researchers over at MIT have built an AI that can do exactly this. I mean, think about that. This isn't a peek into the future. This is what's happening today. It's the new reality of AI in healthcare. And it really all boils down to one simple idea: seeing what we could never see before.
So how in the world does this even work? Well, one of the biggest ways AI is making a difference is by basically giving doctors superpowers. It's augmenting their vision, letting them spot diseases way earlier, and with a level of precision that's just, honestly, it's unprecedented.
Okay, so let's set a baseline here. For people in high-risk groups, a regular MRI is already a powerhouse. We're talking 99% sensitivity for detecting breast cancer. That's incredible, right? A fantastic starting point. But here's the thing. The real challenge isn't just spotting something, it's about knowing exactly what you're looking at and doing it in a way that's fast and efficient.
And this table really gets to the heart of it. This isn't about AI replacing doctors. Not at all. It's about creating a powerful partnership. These AI tools can read mammograms with the same accuracy as a human radiologist. But, and this is the key, they go a step further. They can classify these super subtle details on an MRI and help target screenings for women who need them most, making the whole process more cost-effective. It's all about taking our best tools and just supercharging them.
Okay, so advanced imaging for screenings is one thing. That's huge. But what about the diseases that are hidden, deep inside the body? Places where a normal camera just can't get a good look. Let's go there next.
This is where things get really cool. A company called Odin Vision has developed a system that honestly feels like it's straight out of a sci-fi movie. So during a procedure like a colonoscopy, the live video feed from the scope gets streamed to the cloud. The AI analyzes it, like frame by frame, in real time, and then boom, it highlights any potential polyps right there on the doctor's screen. It's like having a world-class expert looking over their shoulder, giving a second opinion in a split second.
And this quote really nails the real-world impact. I mean, this isn't just a nifty piece of technology for the sake of it. The bottom line is, it leads to way better outcomes for patients. We're talking higher cancer detection rates, fewer polyps getting missed, and it just makes the whole workflow so much smoother for the medical team. That saves time, it saves money, and, most importantly, it saves lives. Okay, so AI is an amazing detective, right? It can help us find diseases, but what if it could do more than just find them? What if it could help us stop them dead in their tracks, maybe before they even begin? We're watching AI's role shift from being a detective to being an engineer. It's now actively helping to design the cures we've been waiting for.
So let's talk about a particularly nasty bug called human metapneumovirus, or HMPV. You've probably never heard of it, but trust me, it's a serious respiratory virus. It's especially dangerous for little kids and the elderly. It can cause anything from a really bad cold all the way to severe, life-threatening pneumonia. And for the longest time, a good vaccine has just been out of reach.
Until now. This is where AI steps in. Researchers have actually used AI to engineer a totally groundbreaking vaccine candidate. How? Well, the AI basically figured out the most stable possible structure for the vaccine's core protein. And because of that, they've created a vaccine that's easier to make and to store. And it triggers a really powerful immune response. And get this, it even works against different strains of the virus. This is, no exaggeration, a monumental leap.
All right, so we've seen AI as a spotter, an extra set of eyes. We've seen it as an engineer, a co-creator. But what about its own smarts? I mean, can an AI actually know medicine? Can it understand it well enough to pass the same brutally difficult exams that human doctors have to take?
Well, a recent study decided to find out. Researchers basically sat GPT 3.5 down to take the U.S. medical board exams, and they tried a few different ways of asking the questions. The first was just a straightforward question. The second was something called chain of thought, where they basically told the AI, hey, show your work, explain your reasoning step by step. And then they tried a slight variation on that too. And the results, honestly, they're pretty fascinating. Just look at these numbers. The simple, direct questions, the AI got those right about 62% of the time. Okay, the more complex show your work prompt, it got 63%. The other version was a little lower. The big takeaway here is that there's almost no difference. All that fancy, complex prompting, it really didn't move the needle.
So what does that tell us? It suggests that these big AI models, like GPT 3.5, have this really solid, built-in understanding of the material. You don't need to be some prompt engineering wizard to get great results. And that's huge. It means these incredibly powerful tools are more accessible, they're more cost-effective, and they could literally revolutionize how we train the next generation of doctors.
Okay, so let's take a step back. We've seen AI help us see better, we've seen it help us build new cures from the ground up, and we've even seen it master the textbook knowledge of medicine. When you start putting all these pieces together, well, a really clear picture of our future starts to take shape. So let's just recap the big picture here. AI is acting like a co-pilot, enhancing a doctor's sight so they can catch disease earlier than ever. It's a creative co-inventor in the lab, helping to engineer brand new cures. And it's making medical knowledge more accessible to everyone. You see the common thread, right? In every single one of these cases, the story is the same. AI isn't replacing the experts, it's becoming an absolutely indispensable partner for them.
And that leaves us with one last big question to think about. As this partnership gets stronger, and as these machines get smarter and smarter, we're all going to have to ask ourselves, in the future, who are you going to trust more with your health? The human doctor or the AI? Or maybe, just maybe, the real answer is the incredible team they're going to make together. Something to think about.